Hey guys, and welcome back. For those of you who don't know me, my name is Dr. Alex Tatem, and I'm a fellowship-trained urologist and men's health specialist. Today, we're going to be talking about a really important topic, and that is Peyronie's disease. What is it, what causes it, and what can we do to fix it? Today, we're going to discuss all of that and more on Season 1, Episode 7 of The Man Cave. So what is the definition of Peyronie's disease? Named after the French surgeon François Guillaut de la Peyronie, who described the condition back in 1743, Peyronie's disease is a scarring disorder where the body creates abnormal scar tissue in the erectile bodies of the penis. This can cause bending, shortening, and deformity of the penis, and in many cases, profound erectile dysfunction. This can make sex difficult or even impossible. But what is the cause of Peyronie's disease? When a man's penis is being used for sex, it is exposed to what is known as axial load, which is direct pressure on the penile shaft. This is completely normal, but sometimes the penis can inadvertently bend more than it's supposed to, which compromises the integrity of the erectile bodies themselves. This type of injury can occasionally be dramatic and painful, but is often so small that most men don't notice it at the time. However, the problem is that the body can then have an overzealous scarring response. This is more common in older men, but can happen at any age. The thick scar that is laid down with Peyronie's disease is dense and often described as a plaque. It frequently contracts, which shortens the penis and causes it to bend with erection. It can also prevent the penis from trapping the blood that it needs to in order to stay erect. So what are the symptoms of Peyronie's disease? Peyronie's disease frequently presents as a new penile curvature that becomes painful with erections. This pain is typically temporary and will fade after a few weeks to months. The curvature, however, will generally increase until that pain resolves. When a curvature is new and still painful, that is what's known as the active phase of the disease. This means that the scar is still forming and the curvature is changing. We want to typically avoid procedures during this period. Instead, we wait until the discomfort has started to resolve and the curve is stable, which is known as the stable phase of the disease. So can Peyronie's disease be prevented? Yes and no. Although nothing has been proven as a surefire way to prevent Peyronie's disease, one of the best things that men can do is seek out early treatment for erectile dysfunction. A lot of men will notice a decrease in their erection's firmness or rigidity as they get older, but will hold off on going to the doctor for years until they're completely unable to achieve an erection. This is dangerous because this decrease in rigidity can increase the risk of injury to the penis and subsequent Peyronie's disease. So if you're experiencing a decrease in the quality of your erections, seek out the help of a dedicated urologist today. So what type of doctor should you see if you already have Peyronie's disease? Peyronie's disease is best treated by a urologist with specialty training and a practice that is dedicated to male sexual medicine. So what tests should a man expect as he's being evaluated for Peyronie's disease? No two cases of Peyronie's are the same. I often tell patients that there are 4 key things that determine how we treat Peyronie's disease. Number 1, is your Peyronie's disease significant enough that it interferes with sex or otherwise bothers you? Some Peyronie's disease may be mild, and some men may want to delay treatment unless things worsen. Number 2, are we in the active phase of the disease or have we reached the stable phase? If we're still in the active phase, we can use conservative options like traction therapy, but we should avoid any sort of procedures until the curve has stabilized. Number 3, how good are your erections? I'll often ask men, if your penis was perfectly straight, would you be able to achieve an erection that's good enough for sex and would be satisfying for both you and your partner? A straight penis that can't get hard doesn't help anybody. And number 4, what is the anatomy of your curvature? Certain types of curvature respond to certain treatments or procedures better. Now, we can test both erectile quality and curvature anatomy using an in-office test known as an intracavernosal injection with or without penile duplex ultrasound. This allows us to assess the quality of the blood flow to the penis while evaluating the shape of the curve. Although this does involve the injection of a pro-erectile medication into the penis, it is generally not uncomfortable and very well tolerated. Now, what medicines can we use for Peyronie's disease? There is a lot of controversy around using oral medications and supplements for Peyronie's disease. There just isn't enough good data to prove that these options are effective. That being said, These medications are generally very safe and frequently don't hurt men to try. In my practice, if a man wants to try some of these oral options as we wait for him to reach the stable phase of his disease, or as we progress through some other treatment regimen, I think that's a reasonable choice. I will typically prescribe 2 oral medications, starting with pentoxifylline, also known as Trental, in addition to daily tadalafil, also known as Cialis. I also recommend an over-the-counter supplement known as L-citrulline at a dose of 1,500 milligrams twice daily. This is freely available from Amazon or most supermarkets or health food stores. So what types of procedures might be required for Peyronie's disease? When it comes to treating Peyronie's disease, there are 3 classes of treatment. Number 1 is traction therapy. Traction therapy is often combined with the oral medications that I mentioned earlier. Number 2 are injectable therapies. This includes options like Xiaflex or verapamil. And number 3, there are the procedures that we do in the operating room. These include options like penile plication, plaque excision and grafting, and penile implant placement. So let's talk about traction therapy. Traction therapy is essentially physical therapy for your penis. By gently bending the non-erect penis against the curve, men can significantly improve curvature as much as 20% or more in some cases. This is accomplished using an instrument known as a traction device. Although there are many types and brands, my favorite is the RestoreX device, as it allows men to actively bend against their curve as opposed to just straight out like with older devices. This enables men to achieve results with just 2 30-minute sessions a day. It can also be used to help regain penile length once sufficient straightness has been achieved. The RestoreX device is available for purchase directly from the manufacturer at www.restorex.com. Although it typically isn't covered by insurance and costs around $500, I tell men with Peyronie's that it's the best $500 that they can spend on their penis. Now, what about injections? Injection therapy is a minimally invasive way to disrupt the scar tissue that causes Peyronie's and is most effective when combined with traction. In regards to the types of injectable medications, there are 3: Xiaflex, verapamil, and interferon. Among these, Xiaflex is by far the gold standard. The medication itself is known as collagenase and is actually an enzyme that is specifically designed to disrupt scar tissue. It is administered through what are known as treatment cycles that proceed like this. A patient presents for 3 separate clinic visits during his treatment week. During the first visit, he'll receive his first injection. At his second, he'll receive another injection. And then at his third visit, a provider will perform manual modeling where the penis is angled against the curve. This helps break up the scar tissue and straighten the penis. The patient then goes home and does his own daily modeling exercises for 6 weeks. Although this can be done by hand, men who are willing to invest in and use the RestoreX traction device to assist with modeling will see even more benefit. This treatment week is followed by 6 weeks of at-home modeling and is considered to be a single cycle, and ideally men should complete a total of 4 cycles for optimal curvature improvement. Men who undergo treatment with Xiaflex alone experience a little over 30% reduction in curvature, while men who use the RestoreX device with their traction therapy can experience an average improvement closer to 50%. That being said, Xiaflex shouldn't be used with certain types of Peyronie's deformities or in men with significant erectile dysfunction. For men with mild Peyronie's disease who do not qualify for Xiaflex treatment or who don't have appropriate insurance coverage, injectable verapamil can be a reasonable alternative. Finally, let's talk about procedures. Inside the operating room, there are essentially 3 types of procedures that we perform to correct penile curvature. The first is called tunica albuginea plication, or just plication for short. This follows a basic anatomic principle. The curvature of Peyronie's disease is caused by scar tissue that is shortening one side of the penis. So in order to straighten things, we can place some permanent stitches to make the longer side match the shorter side. This results in a straight erection. This is a great option for many men as it straightens the penis in a single procedure and doesn't adversely affect erections like some other surgical options. It's also a great option for men who have undergone prior injection therapy but who still require further straightening of the penis. The drawback of plication is that the final erection will be slightly shorter than a man's penis before he first developed Peyronie's disease. In some men, this may not be very noticeable, while in others, it might be. Also, like all treatments for Peyronie's, plication only works for certain types of curvature. Finally, although we work really hard to hide those permanent stitches, some men may be able to feel them and find them bothersome. But in the end, plication is a reliable, one-time procedure that allows men to achieve a straight erection. Our second type of straightening procedure is called plaque excision and graft. With this procedure, we make an incision into the scar and sew on a patch. Think of it like removing the damaged part in the side of a ship and then patching the hole. This allows us to lengthen the shorter side of the penis and achieve a final erectile length and shape that is much closer to what men had prior to developing Peyronie's disease. However, plaque excision and grafting is a much more complex surgery than plication. There are some risks worth considering. The patch that we sew in is never as watertight as natural tissue. This means that some men can experience a significant decrease in their quality of erections after surgery. So this is not an option for men suffering from erectile dysfunction. Also, plaque incision and grafting often requires us to move the nerves that supply sensation to the head of the penis out of the way. Although we are very careful when we do this, some men can experience a temporary loss of sensitivity to the head of their penis. Although uncommon, in some men these changes can be permanent. As a result, plaque excision and grafting should only be performed in men who have a deformity that can't be more easily corrected through other means, who have excellent erectile function, and who understand all of the risks involved. One other thing, it is worth mentioning that men undergoing either plication or plaque excision and grafting can further optimize their final outcomes both in regards to curvature and length by utilizing traction therapy postoperatively. Finally, the third type of procedure that we do in the operating room is penile implant placement. This is the absolute gold standard for men that have any penile curvature or erectile dysfunction, with the highest success rates, the highest patient satisfaction rates, and the lowest complication rates. The way I explain it to men is like this. Peyronie's disease is a devastating anatomic failure of the penis. Not only do you lose straightness and length, but you often lose the body's ability to trap and hold on to blood, which is what causes erectile dysfunction that comes with the curve. Plication doesn't improve erectile quality, while plaque excision and grafting can actually make it worse. So, what we say with implant placement is this. What if we slid our own inflatable cylinders inside the body's natural inflatable cylinders, the very ones that have been damaged by Peyronie's disease? We then hide a small pump in the bottom of the scrotum that a man can squeeze anytime he wants to create an erection. And because these cylinders are stronger than any natural erection, they can actually overcome most curvature on their own. And in our practice, we use a minimally invasive technique for placing the device and correcting the curvature known as the scratch technique. This allows us to place the device and correct almost any curve through a 2 to 3 centimeter opening in the skin above the penis. Although a lot of men view penile implant placement as the most extreme option, that actually couldn't be farther from the truth. Penile implant placement can actually be performed through an incision much smaller than plication or plaque excision and grafting. It's also much easier to recover from. Men who undergo plication or plaque excision and grafting require a general anesthetic and need to refrain from sex for at least 6 weeks. This is in contrast to penile implant placement, which we can perform under a local anesthetic with a mild sedative, while men get back in the bedroom in just 3 weeks. Penile implant placement also prevents continued loss of penile length and girth that many men experience with Peyronie's and ED. So if you're a man with both Peyronie's disease and erectile dysfunction, or even a man with significant curvature over the age of 50, I would encourage you to strongly consider the penile implant and learn more about it. We have a lot of educational resources on this in our practice and through our other videos. I hope this video was helpful and offered some education and insight into Peyronie's disease. It's a complex but common problem that deserves more attention. If you like this video, please click that like button and subscribe. Every little bit helps us reach more men and offer hope to guys and couples that are struggling. If you want to learn more, check out some of the other videos that we have on our channel. For those of you that would like to make an appointment, please visit our website at www.indymenshealth.com. You can request one there or call us at 877-362-2778. Until next time, this has been Dr. Alex Tatem, signing off from the Man Cave.